right. So, hi everyone. My name is Kayla. I'm the Senior Director at Elephants&tea and excited to welcome you to our next session of AYA Power. If you have not attended a Power before, welcome. We're so excited to have you. And if you are back, excited to see you again and for joining us and sticking around for another session. If you are new, Power is an education initiative. It was a combination of Elephants&tea and the AYA Oncology Education Working Group. There was a gap noticed in education for trainees and fellows as it related to AYA care in the oncology space. And so we wanted to create a kind of new innovative way for addressing some of those gaps. And so AYA Power was created. We do monthly webinars, which are all recorded and are available on our website through a library. And I will post the link in the chat in just a minute. But along with our live sessions, there is a database full of all of our previous recordings and sessions that you can take a look at, that you can send to your colleagues in the space who might be interested on all topics relevant to caring for adolescents and young adults with cancer. So please make sure you check that out. I am excited to get us started today. First, just a couple of housekeeping things. I want to send a huge thank you to our sponsors, I'm Not Done Yet Foundation and Eisai Pharmaceuticals. Thank you for your support. We are kicking off our last session of season 2 today. This is our last one. We will regroup and hopefully be back with another season in a couple of months. But I think that we are ending on such an amazing high note with our speakers and panelists that will be joining us for our session today. So I will pass it off to Lauren Ghazal and Nick Giallourakis, who will provide a presentation on the One Herd initiative and then lead us into a panel discussion with 3 amazing individuals, Bryan Walker, Tricia Hernandez, and Yolanda Murphy. So Lauren, I will pass it to you.
Thanks, Kayla. And I'm going to share my screen, hopefully as seamless as possible. All right, you'll see some fun colors and then. All right, and Nick, all good? I just want to see a thumbs up from you.
All good, yes.
Okay.
All right. I'm going first, correct. So hi, everybody. Welcome. I'm Nick Giallourakis, Executive Director and co-founder of Elephants&tea and the Stephen G. Cancer Foundation. And we are delighted that you all are here today. And again, for those with the AYA Power program, as Kayla mentioned, the idea behind this whole program is to get in front of trainees and those in the space to talk about issues that are pertaining to the adolescent young adult cancer community. And disparities in underserved communities is a huge one. And that was the idea behind our One Herd initiative. Lauren, go next slide, please. And before we get going, I do want to say a big thank you to Eisai Pharmaceuticals, Genentech, and Pfizer. These 3 amazing organizations supported One Herd from the start, even before we even had anything going. They believed in it. And I should mention Pfizer, it was the CGen group originally that supported us, and they were purchased by Pfizer. So thank you to these 3 organizations for supporting this initiative, and they keep supporting this initiative as well. Next slide. So One Herd, the idea behind it, let's kind of set the foundation of what we're doing here today and why we decided to do this. Ultimately, myself and Yolanda Murphy, who's on the panel today, was also our content strategist, her and her TEJ Media group, to come up with this idea of a new content campaign focusing on underserved communities in the AYA space. We wanted to not only understand more about the biases that different groups deal with, but rather than just doing this initiative for 1 year, do it for 2 years to start and go on beyond that as well, which we'll talk about a little bit more. On top of that as well, we wanted to make sure not to preach to the choir, because a lot of the times I feel in the AYA space, there's a lot of echo chamber. We're all stuck inside of that echo chamber talking about the same things with the same people. But the idea here was, why don't we perform this research, create a content campaign around it, and then go and market it and bring what we have found in those stories to those that are outside of the AYA space, or even the professionals in the AYA space. So not back to the survivors as well, actually getting in front of people to tell them, hey, this is what the survivors and the patients are saying to us. You need to listen and understand what they're going through on the different biases that they're facing. Lauren, if you can go next slide, please. So again, this fit perfectly with bringing it to the AYA Power program and talking about all the information that we gather in the stories there. So when Yolanda and I put our heads together, we created the different phases. It was actually a 6-phase approach, developing our advisory board, which I'll get to in a second. The setting research initiatives and goals, kind of figuring out what research questions we wanted to ask, how we wanted to do that, and through surveys and things of that nature. And then analyzing the data that we collected from those surveys, from those conversations, and then create content from that, which is our One Herd magazine, which we'll talk a bit more about in a little bit. And then go and market the information that we have gathered, which is part of where we're at today, and then evaluate how that has been going. One of the really cool things that has also been a part of this as we've gone through this process is we've actually changed how we're collecting data on the elephants and tea side of things. This program started in 2023. We changed how we collect data in October of 2023. So we have just over, actually a year and a half now that it's May of 2025, collecting the data when someone registers for any of our programs, signs up for our print magazine. We're asking specific questions that relate to understanding who's part of the BIPOC community, who's part of the LGBT community. And some of the fascinating data that now that we're collecting that, we're actually seeing of those participants in our programs since Q4 of 2023, 28% of our audience is from the BIPOC community, and 21% of our audience designates as part of the LGBT community. Very cool to see that we're actually collecting the correct data and asking the correct questions on understanding that. And that was something that has come out of this One Herd initiative here. Next slide, Lauren. And a big thank you to our One Herd advisors. Lauren, who's leading the panel today and is going to present here in a second on more on the data, was a big part of crafting that. Yolanda Murphy, as I mentioned, who's on our panel. Hopefully she makes it today. It sounds like she's running a bit behind. Avery Allison, Hernan Berangan, Natasha Renee Burse, and Dana Kirkpatrick. So a big thank you to these 6 individuals for helping us craft the survey questions on the direction we wanted to go from here, and a couple of folks still helping us right now and getting into the content side of things. And with that, I will pass it over to Lauren and let her take it from here with the data, and we'll talk more in a little bit.
Yeah, and Kayla, apologize for not introducing me. Totally fine. So I'll introduce myself super briefly. My name is Lauren Ghazal. I am an assistant professor in the School of Nursing at the University of Rochester, and our newly NCI designated Wilmot Cancer Institute up here in Rochester. I'm also an AYA cancer survivor myself, and one thing that was unique about the One Herd advisory team that Nick just referenced in the previous slide was that we are all underrepresented AYA cancer survivors ourselves that brought a lot of guidance to this project. And so I've been tasked to kind of present the data side of this and one piece of a needs assessment that we distributed to our elephants and tea community. And we are currently hopefully submitting for publication in the next few weeks. And so our advisory team, the 6 of us, met with Nick and Elephants and Tea, and our team of 6 spanned backgrounds in research, clinical work and psychology, health communication, and even the entertainment industry. Together, we started to review the literature on top unmet support service needs of adolescents and young adults with cancer. And across our disciplines, and it was truly a transdisciplinary approach, we were guided by both the social ecological model to the left and the World Health Organization's social determinants of health model to the right to build the needs assessment survey questions. And research on the social determinants of health in more general populations show that health outcomes are driven by various factors outside of the healthcare system that we know play a critical role in shaping health. For example, in AYA cancer survivors, and for this needs assessment, we selected questions related to health-related social needs, such as transportation, social support, employment, health insurance, housing, and community engagement. to better understand the population of AYA cancer survivors accessing elephants&tea resources. So categories of the needs assessment were a combination of, again, the review of literature and then also advisory team input and topics related to what was relevant to elephants&tea and the services that they provide. For example, with storytelling and the sharing of one story and experience with cancer through their magazine, for example. We reviewed multiple rounds of the survey with our advisory team in early 2023. And then in April 2023, we began recruitment for the survey. On the left was one recruitment flyer developed by Elephants&tea and the advisory team. And this was sent out through Elephants&tea's social media accounts, in email listservs, and also in the magazine. And more graphic images from the survey and overall One Heard campaign were created with Tej Media, Yolanda's organization that Nick referred to earlier on. And this is on the right. So again, any Elephant&tea community member could respond to the survey. And we're showing just a snippet of this now. So the analysis was done by Dr. Natasha Burse, who was also on the advisory team, and she's from UNC Chapel Hill, and myself. We used SurveyMonkey to collect responses. All raw data were cleaned, and we used data to perform really basic descriptive analyses, so mostly ends and frequencies. Total of 81 AYA cancer survivors completed the survey, and the final analytics simple after removing missing data resulted in 76 AYAs. We presented these results to Nick and Kayla and the Elephants&tea team. We drafted a manuscript of results, and a part of this dissemination and a part of the larger One Heard initiative was dissemination of this work in the January 2025 issue of the Elephants&tea magazine, which you may have seen these 2 pages because they may have appeared in on your doorstep. And so this was a special issue that I'll talk more a bit later on. But in briefly reviewing some of these findings. So our demographics, again, we had a total sample of 76 AYAs. The average age of the AYAs that responded was 26 years old at the time of the survey, with a standard deviation of 8.3. Around 12% identified as Asian or Asian American, Black or African American, Hispanic or Latino. But when you also accounted for participants who identified as multiracial, this number was 25% of the sample. Nearly half were married at the time of the survey and were living in suburban areas, and about 50% responded as currently practicing a religion. The majority were cisgender women, and about a quarter were sexual minority, so identifying as lesbian, gay, bisexual, or asexual. And the majority were also employed and privately insured. Around health-related social needs, we looked at transportation and financial hardships specifically too. Around 30% had relocated back to their parents' home following their diagnosis of cancer. And as it related to transportation to medical appointments, 70% used more than one method or mode of transportation to receive their medical care. So that is, it could have been their own vehicle, public transportation, ride sharing, like such as Ubers or Lyfts, or receiving rides from friends or family. And we did explicitly ask about financial toxicity and gave the definition of the following in the purple box. Financial toxicity, again, was defined as that negative impact medical expenses can have on patients in terms of their health-related quality of life, leading to negative mental and physical effects. And it was important for us to have some definitions for some of these topics that are so often used by researchers and healthcare teams now, but for patients, there may not be a central definition. And so just to make sure that and ensure that participants who were responding had a guiding definition. So nearly 51% reported experiencing financial toxicity as a result of their cancer diagnosis. And also 51% endorsed receiving financial support or assistance from family or friends. And while most AYAs expressed positive perceptions around their care team and receiving of their oncology care, there were findings about perceived bias and discrimination that we wanted to highlight. So again, 88% reported being satisfied or very satisfied with their care team, and around 85% reported feeling at ease with their care team. When asked about bias and discrimination, definitions for each of these concepts were provided on the right. 20% reported experiencing discrimination from their care team. 4% also responded that they didn't know. 26% reported experiencing bias from their care team, and around 13% also responded that they did not know if they experienced this. About 6% reported fear of unfair treatment for reporting discrimination. And again, 28% reported that they did not know. And this did not know, in talking with Nick and talking with other members of the team, it reinforced to us how important we would say the qualitative data, or how important the storytelling was to really uncover what was it around not knowing that they weren't able to respond as a yes or no here. So this sample also had high levels of support at home and had caregivers that included a parent or partner, and oftentimes more than one primary caregiver. Most, around 65%, reported isolation from their peers, being not feeling connected during treatment. And as far as storytelling, 95% had shared their cancer story with friends, 70% shared their story with strangers, and 26% had shared their stories on social media platforms. 26% also expressed difficulty articulating their story, while most, around 56%, found sharing their story at least somewhat easy. Almost half had developed new friends or obtained cancer-specific resources from attending community events. As far as other resources and support, 45% of the sample of AYAs reported that spiritual support at their hospital. Around 40% endorsed not being aware of these services or support. 62% reported fertility discussions had occurred with their care team, and nearly half were presented with fertility preservation options, Only 10% remember being presented with financial support options specifically for fertility preservation. Around 53% were provided information on mental health support. Again, 16% could not recall, and 51% were provided support group options. Prior to their diagnosis, 35% of AYs in the sample saw a therapist regularly, and 64% were currently seeing a therapist following their diagnosis. Lastly, nearly half reported a preference for one-on-one support for mental health support. So again, just sharing a snippet of those results. What happened next after we had looked at these data was that the advisory team assisted with the development of a content campaign through storytelling. So one of the final questions that we asked in the needs assessment was an inquiry to the participant as to whether they would be interested in sharing their story in a special issue of the Elephants and Tea magazine. So alongside analyzing survey results, those who had expressed interest in sharing their story were invited to submit a narrative to Elephants and Tea. And these 10 narratives of storytelling were amplified in the January 2025 special issue with pictures, graphics, and then also with the snippet of data that you saw in the prior slide. So what we did today as part of this AYA Power session was to not only share the research data results in the survey responses, but also make space for the continuing of the storytelling from 3 authors themselves. So I'm going to stop sharing my screen and then open it up to have all of our panelists turn on their videos. And just want to welcome you all again. I wanted to first just have you briefly introduce yourselves, and then we can start with some of our questions.
Thanks, Lauren. I'm Tricia Hernandez. I am the Director of Community Engagement for our National Patient and Professional Programs at the Leukemia and Lymphoma Society. And I'm also excited to be here as a queer Hodgkin lymphoma survivor of 23 years.
Bryan, you want to go next? Or Yolanda, you want to go next? I think you guys both are on mute, so.
No problem.
Yeah.
Good afternoon, everyone. My name is Yolanda Murphy. I hail here from Pittsburgh, Pennsylvania. I work at the Hillman or UPMC Hillman Cancer Center here as a research coordinator for our community outreach and engagement department. And I am a now 9-year breast cancer survivor.
Good afternoon, everyone. I am Bryan Walker in the best city in the best state of Atlanta, Georgia. I am coming up on my 10-year cancer anniversary of Hodgkin's lymphoma.
Thank you all so much. Yolanda, it's so good to see you. And so how we structured this, and I know we met previously, so some of these questions were fielded before. Some of them we're going to be taking from the audience as well. But just to set up this panel too, I would love for each of you to briefly describe your One Heard piece, your narrative that you submitted and had published in the January 2025 special issue. And I would love for you to particularly highlight the biases that you encountered as part of your cancer experience. So anyone want to go first? Tricia's off mute, so there you go.
I keep off mute or else I'll forget to turn myself off mute when I'm supposed to be speaking. But I just want to say first, thank you so much to Elephants and Tea and for you, Lauren, for having us here today. I think right now this is an incredibly important conversation to be having. I wrote in my One Heard piece about my cancer experience, being diagnosed and going through treatment, and then living in survivorship through the lens of being a lesbian in a marriage. And so I think what was interesting for me is when I was diagnosed and going through treatment, I don't think I even associated my sexual orientation with what was happening. And this process of writing through it really did make me think, was this bias? So, you know, I think it was really an honor to get the invitation. So I wrote about getting diagnosed at the age of 32 when I was preparing to take a new job offer and getting ready to start a family with my now wife. And all of that obviously stopped. I couldn't take the job offer because then I wouldn't get insurance coverage due to a pre-existing condition. And we couldn't even think about starting a family because I had to figure out what was next. And I thought death was next. So we had to kind of work through all the emotions of that. And then after that, through the diagnostic period of, it took a couple of months for me to even get diagnosed. They weren't really sure. They thought it might be this or this. So when it was the less intensive things they thought it might be, they wanted to run me through all the testing for those. And then finally, I got a lymph node biopsy that revealed my Hodgkin's diagnosis. The most challenging thing for that, and again, my wife was in the room for this, but they didn't like say it to her. They were saying everything to me. And I had to turn to her when they said the word oncologist. And I still get quite emotional about it today when she says, "What's an oncologist?" And I had to turn to her and tell her it was a cancer doctor. Why I already knew that, I think, was because of my dad's own experience with cancer, but I'm not even really sure why I already knew what an oncologist was. But because I wasn't living or working in this cancer space at all at the time. And then after that, it was going through treatment and showing up at treatment and chemotherapy chemotherapy administration. And so after getting blood work drawn and the needle inserted in my arm, I was actually not able to get chemotherapy for almost 2 hours. I had to sit in the waiting room in that state. And again, my wife had to go up repeatedly and advocate on my behalf, and I'm not sure they recognized her important role as my primary caregiver in that space. I think lots of times throughout all this, I feel like they thought she was my buddy friend who brought me to all my appointments, or she was my sister. We don't look anything alike, but who knows, right? And so I think at the time I just thought, I'm exhausted. I just need to get through what's next. I need to figure this out. But I never thought about all of this until I was able to reflect on it. And then in survivorship, it's just been really trying to kind of figure out what's next for us as a couple and trying to build our family. And I'm thrilled to say that we were able to return to that process a few years after I completed treatment. And I actually was able to give birth to our son 3 years after completing treatment. And he is now 18 years old.
Thank you so much, Tricia. Bryan, do you want to go next?
Yeah. Again, thank you all for taking the time to sit in here. My cancer diagnosis story started at the wonderful age of 25, right? I felt like I was on top of the world. Had recently relocated to a new city to do things on my own, a new state to find out who Bryan Walker was. And over the time, I was misdiagnosed. If you add up all of the doctor visits 4 times, five times total, but 4 times that I can consider, I was showing signs that more tests should have been done and completed. As I look back on it now, I think there were some biases there that, and I don't know if they were racial biases, probably more of the ageist bias that probably kicked in on majority of those, because I had all of the symptoms, but they were presenting at different times, right? And so there was no follow-up to look back at the old charts to see what I had until I had a final, what I call a blow-up, in which everything went downhill there. But I also was misdiagnosed. Once I got into the hospital and had already did the biopsy, they came back and told me I had one cancer. My mother advocated, who was a nurse, advocated for me tooth and nail and was going to bat for me. And it was a scary time because it was one of those, I've worked in the healthcare space. I've seen how, I'm not going to say combative, but I've seen when people have pushed the limits to physicians and things have changed, right? You know what I mean? The conversation has changed. The air in the room has changed, right? And so, I remember my mom, and I love her to death, but she was going at it with the physicians and telling them that they were wrong and this was not right. And she was ready to remove me. And I was like, Mom, no, be quiet. Like, listen, the doctor knows what they're doing. But in the end, my mother was right. And so one of the weirdest things is being 25, having to pack up everything in your house very, very quickly, move back home a whole nother state away, to start treatment. Not only did I move, I lost my girlfriend at the time, and that was a moment in itself, in which was another hill I had to combine and climb. But even moving on to fertility, I specifically remember the day before I was supposed to start treatment, I got a phone call, not from my oncologist, but from my team. My social worker called him and was just checking the boxes to ensure everything was going to be okay for the next day. And we never talked about fertility. I wasn't even thinking about fertility, right? It was one of those, let's do this, let's get this treatment, let's get it done over. And I remember having to go to the treatment center to give a sample, right? And then finding out that there was no sample there to take, right? And then it became, well, your treatment's starting tomorrow. You can come in earlier. We can have it where we can draw it out with a needle. And I was like, you're not sticking me with anything like that in a needle anytime soon. I'll take my risk, right? But the decision had to become, it was so swift, and that I don't feel that I was able to give a proper decision at the time, because it would almost felt like, life or death, right? And at this point, you need to choose life. we're worried about having kids and things on the back end. And so, that was the portion that really, really hurt me. But I would like to tell everybody, as I was going through treatment, I remember the first time I heard the words, "I had cancer." I don't remember anything else after that, probably the rest of the day, right? And it hit me, and it turned into Charlie Brown all over. What they say, episode 1 through 200, every time he went into class. And so I was blessed to have a family around. Not everyone does, but I was blessed to have a family around who was able to take notes, I was able to lean on because they were in this space and they give me the best options that I have. And I strictly remember one time my mom asked me, because it became time to do a clinical trial or the normal process treatment. And I was like, well, I want to do the clinical trial because I want to save other people. And my mom was like, wait, right? I know that's what you want to do, but is that the right thing for you? Right. And that is when I felt empowered to actually sit down, read through things and work my way through. So as you can tell, I've been 10 years out. I've been cancer free. So I felt like I made the right decision at that point. And then moving to survivorship, right? Survivorship has been an interesting stepping stone for me. I always tell people, the most difficult thing is when everyone around is telling you that you're okay and you don't feel it. You don't feel okay. And so, I had to lean on going to therapists and going to see, therapists and treatments, and leaning on different other young adult cancer organizations who were out there, who were really providing the services that were needed in the community to help me, mind, body, and soul, to get back out. And then also, last thing I like to end on, I hope, and I know we'll probably get to the question on this one here, but I don't feel that I had the proper educational long-term impacts of treatment. I tell everybody from year 0 to 5, I was great. You know what I mean? Everything was good. From 5 to 7, probably 5 year to 8 year. It has been a very difficult thing. There's been things popping up that all lead back to treatment and cancer and things. And so as I've navigated that space, it's been one of those, dog it, I wish I would have known. I probably would have said yes to do the treatment, but it was like, the neuropathy and the other things that pop up that are just, it sucks, right? And it's 10 years post, and now, I still have some issues popping up. And so, I just wish I had some of that information in the beginning, and I could have got it, all right? They could have gave it to me, but at that time, I wasn't listening, right? I was so shut down with cancer and death, right? Tricia talked about, hearing, thought cancer and death. So I will be quiet because I know Yolanda's got some great things to say.
Yeah, thank you, Bryan. Yolanda?
Yes. Thank you, Bryan. I'm going to echo some of the things Tricia and also Bryan said, but my piece with One Heard was, years ago, Nick and I came up with this concept that voices need to be heard. Anyone that knows me knows that since I was diagnosed in 2016, much like Bryan said, you hear cancer and everything else goes out the window. At the time, I was 36 years old. So some of the biases that I faced was based upon not only being young, but also being African American in a city that is predominantly Caucasian, and also can sometimes be a little, racist, hate to say the word, but we are unfortunately known for that throughout the generations and years. So on the year that I went through treatment was very uneventful, if I'm quite honest. I went through chemo. I did surgery. I had radiation literally from the top of 2016 until the end. And then it became October. I did everything. I walked out of the cancer facility and no one prepared me for what was coming next. Um, it was really much like Bryan said, the long-term effects that had the most impact on me. Everyone said I looked fine. No one believed when I was coming into chemo that I even had cancer. You don't look sick. You're too happy or you're too spry to really have breast cancer. You're too young, are things that were being echoed over and over again to me. And coming from a family of very strong African American women who just get the job done, that's what I did. Throughout all of my treatment, I pressed, I pushed. My faith played a huge part in that as well. And so I pressed and I got through. Like I said, it was very uneventful, but no one prepares you, much like Bryan said, for the emotional or mental toil that comes from being in less than 40 and having to navigate menopause, early medical menopause. No one told me that as a woman, um, even before 40, getting mammograms, what I had to look forward to when it comes to that. Because now it's an every year part of my life. Um, so a lot of the things that I faced long term, much like Bryan said, after 5, I was like, okay, this feels good. This, we're going now to the doctor maybe twice a year, not every like 3 to 6 months, 3 to 4 months. Okay, this feels good. I'm feeling physically okay. I'm gonna come off tamoxifen. Okay, I don't know what this body's gonna feel like after that. After I've not had a cycle for like 4 or 5 years, let's see. Yeah, no, I love my whole oncology team. I really do, but no one prepares you mentally or even physically for what comes next. And again, everybody's body is different. Everyone goes through, no matter, of course, the diagnosis, whether it's the same or not. Everyone goes through it differently. But it was quite at year 6, 7, maybe even 8. Um, no one prepared me for the bodily changes that were going to take place, the mental changes, from going from being a cancer patient now to a long-term survivor. Your friends, much like Bryan was saying in regards to fertility, I didn't have time. My cancer was quite aggressive. I had to get surgery and start chemo right away. I couldn't do the preservation. I didn't have time to, at least my oncologist didn't think it was wise. And so no one talks about, now that I have friends, and I even, sorry, still get emotional about it. They have kids going to college, and I was never able to have that. So, long term, people don't prepare you for it. And I know there's but so much people can do, but I'm glad that this space is available for us to talk about our stories and to tell our truths and to share our voices. And I'll keep it right there before I break down and cry.
Thank you. And I have to say, I love with the webinar format. I'm like, I can't see anybody else's faces, but seeing the hearts come across with hearing each of your stories. I don't know if others can, it's powerful for an emoji. I guess I'll just say that. Thank you all for, sharing, your story in like the 5 minutes or 3 to 5 minutes I think I gave you. When we met a few weeks back too, we had a really robust discussion too on the why you decided to entertain Nick's request, whether he reached out to you directly, why you decided to share to pitch your story and write that and sit down and write. And we know sharing your story in any avenue, any method is vulnerable. It is your story. And it's once that's public, it's really hard to kind of reconcile those emotions after. Um, but we had talked about that why, right? The why you wanted to share the story. So, especially out of the One Heard special issue. And you both, I mean, I think definitely Bryan and Yolanda touched about this too, and you as well, Tricia. But what were the reasons? What made you say yes?
I think, like I said in the beginning, it's just really important to have these conversations. One of the things that is the thread through all 3 of our stories, and I didn't mention this when I was talking, but like Bryan and Yolanda, no one told me what was next. No one talked to me about no one talked to me about fertility at all. This was a couple of decades ago, and no one asked me or my wife and I if we were considering having children. No one said this is what you might need to think about if you are considering that. And as Bryan said, I was in zero condition to ask. I absolutely was not prepared to have that conversation. So I think then, yes, the burden falls on the care team to ask those questions, to have that conversation, but it could be a 5-minute conversation that could be life-changing for any one of us who then travels into survivorship, thankfully, but so far less blindly. And I think the thread through all of ours is that lack of communication and not setting expectations and not really helping us understand what would be next, and really helping us frame that in whatever experience we're coming from, whether it's LGBTQIA or Black, or if you're rural or AYA or whatever is. I'm also Hispanic, you know. I mean, you can run the gamut of all the different perspectives we live in our experience every day. But what was vitally missing is communication. So I think storytelling is only that, right? It is communication. And so by us giving back to all of the practitioners on this call of communication is key. We're telling our story, so you will help us understand what our story will be after cancer.
Yeah, there are two things. First off, Nick is amazing. He's an absolutely wonderful individual. So anytime he reaches out, you know, I do listen. And because he has a plan and his plan is real. And you don't find that in a lot of spaces, right? And I think for me, what made me want to write it is two things. I specifically remember walking into the chemo room, and there was not only no one who looked like me from an age perspective, there was no one who looked like me from being a young black male perspective, right? And so I remember there were a lot of questions that I was probably ignorant to, you know, enough in that to even ask. But I remember there were certain things that happened, and I was just like, this doesn't feel right, you know, like it doesn't feel right. Should I speak up? Shouldn't I speak up? But my social worker at the time, who was amazing, she walked up to me one day and said, I typically don't tell people this, but you're depressed, right? And she was like, you know, I need to get you some therapy, and then I need to connect you to different organizations in the space, young adult specific, right? And the community that was built around me that I walked into the day that I joined that space from different organizations took me under their wing. And I started realizing that a lot of the things that I wasn't alone, right? It wasn't just me, right? I might have been the only one in that space, but there was others out there who looked like me, same age, same diagnosis, same things, who I could lean on for questions and answering. And then also, you know, after that, you know, one of the things I always say is I always want to send the elevator back down, right? There's always another Bryan out there who might not know, who might pick up a magazine and read my story and say, that's me. And the end goal can be successful, right? And to keep that positive mindset while they're going through.
My why. So I'll definitely take my hat off to Nick. I met him years ago, of course, but same Bryan, you know, in my community where I live in Pittsburgh, again, in any treatment area, any doctors that I've seen, no one young, no one African American. And in my faith-based community, I'm Christian, not that that matters, but it's not really talked about. Cancer is not spoken of very openly, or at least it wasn't years ago. You know, when you were little, you know, my grandmother's, oh, shh, don't say the C word. Shh, we don't talk about it. It's taboo. So my why has always been, specifically after I finished, is that there's always going to be someone that needs to know what I've gone through so that they can have a better experience about it. So my why was connect with as many nonprofits as possible, connect with the Nicks, so to speak, of the world, the Laurens of the world, and garnish all of the information that I can so I can take it back to my community, so that at least someone is passing it down, even if it's by word of mouth, if it's by attending events. Because if I wasn't going to do it, who was going to do it? Because I didn't see it here. Majority of the organizations that I initially connected with weren't here. Now we have some great organizations like Yes You that are here, and some other nonprofits that are in the city. But my why is always to share my voice. So not only I can be heard, but people like me can be heard. But also continue to garnish and learn all I can, even all these years later, so that, you know, people in my family over the last, I can't tell you what, 9 years since I've been diagnosed, at least 4 women in my family have been diagnosed, 2 of which were young adults, that I was one of their first calls when they found out they were diagnosed. And they were like, what do I do? What questions do I ask? Come to me with my doctor to my first doctor's appointment. That's my why. That is the reason I do it. So that people don't have to feel alone like I did.
Thank you all again for sharing that. Tricia, you're making my job easy and threading the needle throughout all of your stories and tying that back to that real central unmet need that we're hearing of communication. We know, I think I shared that in one of the slides too, the 88% of AYAs that responded were satisfied with their care, right? We know, as a healthcare provider myself too, we know there are barriers to having every single conversation you can have in a 20 or 60-minute meeting. But we talked about, tangible solutions, things that providers can be doing, things that care teams can be doing, integrating. Based on your experiences, right? What can providers do to learn from your stories and your experiences? And then how can they take these experiences back to their respective clinics? And anyone can start too. It doesn't have to be Tricia, but
Bryan or Yolanda?
I'll go just really briefly. I think it's highly imperative that coming through the ranks, people learn to listen before they speak. Um, it's amazing. Again, like you said, Lauren, I was highly taken care of by my medical oncology staff. They were amazing to this day. Some of them I bump into because I work at the cancer center where I got treatment, full circle, right? But um, some of them still to this day, oh my goodness, how are you? They're amazing. But like it's been echoed, the extra 5 to 10 minutes you can take that can make a world of difference for me 5 years from now. Excuse me, I'm getting over a cold. 5 years from now, 7 years from now, that can make or break how I feel mentally or emotionally about myself, can make a world of difference. And I know, just like you said, Lauren, we're on borrowed time when we're in those doors. Once the doors close, hello, how can I help you? The conversation that happens, we know we're on slotted time. We know everyone is busy. But when we come in looking like a deer in headlights, sometimes we just need you to listen. Sometimes, again, it only takes a short period of time for you to hold my hand or pat me on the shoulder and say, "You got this." For you to tell me, depending upon what we're talking about in the appointment that day, if it's about blood work or if it's about getting new scans because something might have shown up as a shadow, or what have you, take the 5 minutes. Okay, these are the statistics, and or this is what I think about it. Breathe. You got this. All right. I feel a little bit better about it. But again, I think the listening communication, I mean, I think it just goes back to that. But you all let me know what you think.
I would only echo that. Take a beat. Take a beat as you're taking care of your patient. Take a step back and think about or just ask the questions. Just, what are you really freaking out about today? What are you thinking about? Pick one thing, because if you pick everything, it just gets overwhelming and you definitely don't have time to cover all that. But I'll tell you, the other thing that came up to me when we met previously is timing. So Bryan, first I want Bryan's mom and social worker forever and ever by my side, because I had neither to that effect. But the social worker did show up on infusion one day when I was in a giant room full of other people getting infusions too in our plastic lazy boy room. And she squatted in front of my chair and she introduced herself and said, "I'm the social worker." And oh my goodness, today I can feel so bad for her because she just picked the wrong time on the wrong day. um, I had just sat for 2 hours waiting for infusion to get the prior authorization. She didn't know that. So I was exhausted. I had no idea what these chemotherapy drugs were going to do to me. I was already exhausted. I honestly didn't care. I just wanted to get done and go to bed. I was over all of it. And she said, "I'm here to help you You know, tell me what's going on, any needs you have. I'm like, I have no idea. I have no idea what needs I have right now. Right now, my need is to get through this and get to bed because I don't know what's going on with my body or my brain and all of that. I never saw her again. That was it. Box checked, social work check-in. I know this is by far not the experience of many of my peers who have undergone cancer. So I only say this to say that she could have taken that moment and said, you know what, today doesn't feel like a good day. Um, how about if I connect with you at the beginning of your appointment next time, or sometime where I'm not at the end of 4 hours of infusion and exhausted and dealing with all of that. So I think timing is key of being thoughtful and not to hand a giant binder of written information to a young adult patient who is trying to figure out what today means, because honestly, most of that is never going to get looked at. If it does get looked at, it's going to be years later when it is of less use to them. So I'm really thinking that both timing and just taking a beat to ask even just one question, like Yolanda said.
Absolutely. To follow up on both those are great points. I think for me, communication, number one, throw away the pamphlets. I don't like looking at pamphlets. I never have. I'm not a pamphlet guy, right? It just doesn't work. But for me, it is communicating at a level that the patient can understand. I think sometimes as we move through the healthcare space, we think someone understands what we're saying and they don't, right? The terminology is different. So being able to ensure that they are able to understand what's going on, what is to come and what's to happen. And then one of the things that I absolutely hated was they used to give us these pamphlets that we had to fill out before each session that would say, you know, do you feel like hurting yourself? Have you thrown up yesterday? You know, and it was all of these questions. I lied on all of that. I'll just be honest with you, right? It was chemo day. I didn't want to be there in the first place. And then if I answer the wrong question, I'm probably going to be here for some extra time, right? So for me, you know, I always tell people, get away from that, right? Come to me as an individual. Let's talk this through. When I write it down, it becomes official record. And then now I'm stuck in the hospital, a place I really don't want to be even longer.
We've had some really great questions. I know I'm Nick's on. I wanted to ask one question, just the panel in our few minutes. So as you navigate your continued survivorship space too, some of you are maybe still receiving care from your primary oncology team. Some of you may transition fully back to primary care. Some of you may be in between or neither. There was a question here on, as you navigate your survivorship space, do you tend to seek out care at the center that you saw original care? Or do you see a PCP for most of your care? And do you find that difficult to navigate, especially in the years after treatment? And that probably was have time for one or two of you to respond. But that's so important as we think about, you know, especially young adult cancer survivors living longer into long-term survivorship.
I'll take a shot at that one quickly. For me, I moved, right? I needed to get out of Birmingham. It's a wonderful place to be, right? But I felt like I'm much bigger than Birmingham. But for me, it was once I still went to Birmingham, especially for the first 5 years, because I wanted to have that same treatment team and rolling through, so everything to be the same. And then after that, I did transition to a PCP who I've been with, and he actually still works with my oncology team. If there's anything popping up, so it has been a wonderful communication level between those two.
My oncologist gave me the option after 5 years of, hey, you can keep seeing me or you can go see a primary care. I did go see a couple of primary care practitioners. I have dated quite a few. I finally have landed on one I can hang out with for a while. And so yeah, I have one now that I do. I take my healthcare as I'm aging, particularly a little more seriously, and so I get annual visits from a PCP.
And just real briefly, I have both. So I still see my medical oncologist, and I also see my PCP for more general, overall health types of things. But I still see my medical oncologist once a year at this point.
All right, thank you. And there were a few other questions that I didn't get to. The one that I wanted to address was just around the makeup of the survey cohort. There were additional questions asked around time from diagnosis. And I believe, Amanda, if you wanted to reach out to me, I'd be happy to share some more about that as well. But what's great about this method of a community engaged research project is that if you have feedback from either the data that was presented, if you have questions or thoughts about, provider, there was a question in the chat around provider side. What are some initiatives? What are some ways to improve that communication around known biases? Email Nick or I. We are happy to incorporate in the larger One Herd initiative with Elephants and Tea. And just thank you, Bryan, thank you, Tricia, thank you, Yolanda, for being here. And thank you to the others also as that shared their narratives in the One Herd issue. If you don't have one, I'm gonna make Nick send it to you if you reach out to him. I'm sure there's extras, but I'll turn it back over to Kayla and Nick. Thank you guys so much.
If I could say something before Kayla wraps up, I just want to again thank you, Tricia, Bryan, Yolanda, and all the authors that participated in the One Herd initiative. It was truly breathtaking reading all the stories and everyone having a different story to tell and why it's so important. Storytelling is huge, right? And that is something that needs to be talked about more and more. And as Lauren has talked with the stats and stuff that we have in the surveys and how important it is for people to share their stories with each other and how much people want to help each other. I think Bryan's quote of sending the elevator back down, I thought resonated with me and a lot of other people in the chat too. So thank you all. I know it is not easy to do that. And please check out One Herd because there were a lot of different biases that we didn't even anticipate to see in this study. Autism, for example, was one that was featured in there, and that was something that pretty powerful. So please check it out. It's very important. And again, thank you to these three and all the authors for participating, and Yolanda for being our cohort partner in this from the start. Appreciate you, my friend. All right, I'll pass to Kayla now.
Thanks, everyone. We are honored that you joined us for Power this afternoon. I think we can express incredible thanks to all of our panelists, Yolanda, Tricia, Bryan, Lauren, and Nick for sharing about One Herd and just everyone's vulnerability and curiosity around the topic. I think the other exciting piece is that we're not done. The work is not done. We will be continuing to share the stories, to share the initiatives, to share the changes that are going to come from the stories that have been shared with us. And so look out for more as we continue to just keep the voices going and keep them active and loud. I dropped a survey link in our chat. We always take feedback for our power sessions and how we can make them better and improve what you liked, what else we can be doing, what other topics. So please fill that out. It's very brief, it's anonymous. But thank you for joining us for Power this afternoon, everyone. Huge thanks again. Enjoy the rest of your day and the rest of your week, everyone. Thank you so much.